Both snoring and sleep apnea are caused mainly by an obstruction to the airway at the back of the throat. This therefore limits the amount of air going down to the lungs, the oxygen level in the blood, and therefore around the circulation and to the brain reduces. This causes our brain, while we're asleep, to call for a deeper and faster inspiration of air. It's this sudden rapid inspiration of air passing along the back of the throat that causes both the sound made by snoring and also the gasping associated with sleep apnea. When we look at an anatomy of what happens in the back of our throat, either on an X-ray or a diagrammatic picture like this, what we're seeing here is the cross-section looking at our throat. So here is the tongue, here is the bony soft palate, the bony hard palate and the soft palate. Now, whether you've got a nasal obstruction or not, air has to pass through here to go down the tube to our lungs. On the X-ray you can see the air either has to come through the mouth, down through the passage here to the lungs, or it has to come through the nose. The obstruction point is actually here, so people who have snoring and sleep apnea, they get a relative obstruction there. The noise of snoring is caused by the sudden called for inspiration of air. When that air accelerates past this very narrow gap and it's squeezed through there, it sets up a vibration, and it's mainly the vibration of the soft palate that causes that guttural snoring sound. Sleep apnea is just a slightly more accentuated aspect in that there's more of a complete obstruction, and that's the commonest cause. With our treatment at Specialist Clinics of Australia, our laser treatment is very effective at opening that airway by contracting, tightening and lifting the soft palate, allowing more air to get through to the lungs and therefore reversing the whole situation.